optional data in the ambulatory care setting, but not in the inpatient setting. Some of the discussions around that was that given that patients are acutely ill and have extended periods of stay, it would be difficult to determine what data should be collected, how to interpret individual blood pressure readings, given the acute illness of the patient, and then also how we would actually conduct a population assessment of blood pressure readings in this setting. I think how to use and interpret this data from the ambulatory care setting, although unknown at this time, is felt to be possible in the future, and there are currently projects and initiatives underway that are attempting to do so. So those were the recommended guidelines that were specific to syndromic surveillance for meaningful use for the eligible hospitals, inpatient setting, and for ambulatory care. So I want to look a little bit, take a little bit broader look at the recommendations, more general recommendations for meaningful use as part of the overall EHR incentive program. So for stage 3, the work group recommended retaining electronic syndromic surveillance reporting as a core objective for eligible hospitals. Recommended that hospitals must provide data for patients in the emergency department setting, and upon request of the public health, they must also report data for patients in the inpatient setting. Since there's both limited experience and as I said, I think the literature with some demonstrated utility, but as I said, but probably on a limited basis, with syndromic surveillance in other settings, we recommended that we retain syndromic surveillance reporting for the eligible professionals